Good morning, members. I call to order the meeting of the Subcommittee on Issues relating to the support for persons with disabilities. I will now invite the government officials from the Education Bureau to join us. We will start with Item 1, Education Support Services for Students with Disabilities or Special Educational Needs. We welcome Mr. Jeff C. Junfai, Undersecretary for Education, and Mrs. Gloria Lee, Principal Education Officers, Special Education of the Bureau. Please refer to paper CB brackets 1 1673 brackets 01 Administration's paper and Secretariat's background CB brackets 1 1673 brackets 2. I now invite the Undersecretary to walk us through the Administration's paper. Thank you. Good morning, Chair, members. The Education Bureau attaches importance to supporting students with special educational needs. We adopt a dual-track model in primary and secondary levels. Besides allowing SEND students to study in ordinary school, now with the consent and assessment of specialists and parents, we refer students with more severe or multiple disabilities to special schools for intensive support services. From the perspectives of educational profession and also the needs of students, we have been dedicated more resources in terms of manpower and professional support, learning and teaching materials and teacher training. We seek to enhance support for special schools and ordinary schools for supporting SEND students. Now, there are 60 special schools. Depending on the type of schools, the class size range from 12 to 20 people. Now, besides enhancing the teacher establishment, according to needs of students, we also provide teachers for enhancing the regular establishment. We also provide supporting staff for the boarding session of special schools. We also provide special subsidies for the boarding session of special schools. Now, we provide teacher training for teachers in special schools. For example, foundation course for special school teachers, leadership development program for middle leaders of special schools, and training course for special school teachers. We also organize seminars, workshops, and experience sharing sessions to enhance the professional capacity of teachers in supporting SEND students. Now, the team would implement tailor-made and individualized learning plan for SEND students to help them attain education goals. For ordinary schools, we promote the whole school approach and support ordinary schools in providing education without discrimination to SEND students. Now, besides ordinary subsidy, we also provide other resources, for example, the learning support grant and additional teacher quota. We also support schools to establish a dedicated teaching post of special educational needs support teacher and special educational needs coordinator. Now, school-based educational psychology service and enhanced school-based speech therapy service are provided in all public sector schools over the territory. Now, we also support development of learning and teaching materials. We also recommend scientifically proven pedagogical strategies to ordinary schools to enhance teaching capacity of teachers. Now, we have the three-tier model ranging from basic, advanced to thematic courses. We support SENCOs to equip themselves with professional capacity in supporting SEND students. Now, to share with the general public and the parents with information about special education and promote the experiences of integrated education, we have launched the SENS information website. Now, through the one-stop platform, Smart Parents Net, we provide practical information and video clips to help parents develop parenting skills and promote the emotional management of parents. We will continue to provide more resources and support to schools and parents. That concludes my summary of the Education Bureau's support services for students with disabilities and special educational needs in school. We will be pleased to answer members' questions. Thank you, Chair. Thank you, Mr. Jeffsey. Now, members who would like to speak, please press the button. We have ample time. In the first round, each member will have 4 minutes, questions and answers included. First, Professor Chen Wing-Kwong. Thank you, Chair. Now I have the following questions concerning government support for special education. Now, there is a very limited number of quotas. As a result, many SEN students need to commute to other districts for learning. Now, that is not ideal for the growth of students with disabilities or special educational needs. So how many quotas are there in total in our special schools? And how many of our special educational needs students are studying in ordinary schools? Should we provide more quota places in special schools? According to media reports, there were often incidences of special schools staff abusing the students. They were minority cases, but one case is too many. How can we prevent that from happening again? Mr. Jeffsey. Thank you, Chair, and thank you, Professor Chen. On school places in special schools, as mentioned in the paper, there are altogether 62 government-subsidized special schools, providing a total of 9,900 school places. Education is provided for students with various types of special educational needs. As of September this year, some 9,000 students are studying in special schools. Now, the member is right. For students who need to study in special schools, they come with a wide range of special educational needs. We have 7 clusters of schools in Hong Kong. We endeavor to provide sufficient special school quota places in each cluster. However, there are various types of impairments, for example, hearing impairment, visual impairment, physical disability, intellectual disability, and group schools. So we will continue to critically review the provision of school places. When suitable place is identified, we will consider building more special schools. Unlike ordinary schools, we can't wantonly allocate more students to a school because there is a set teacher to student ratio to ensure adequate support for individual students. Concerning Professor Chan's question about child abuse and cases warranting society's concerns, we attach much importance to them. We adopt a zero-tolerance policy. For suspected child abuse cases, we will act decisively. Through enhancements of training and also by allocating more resources to the boarding session, for example, installation of CCTV, we now have the capability to gather evidence when such tragedies happened. So this is our priority. We also organize workshops in educate in positive supporting skills, and also workshop on providing support for SEND students. We equip special school staff with professional skills. We also collaborate with NGOs to organize online thematic courses for teachers in special schools and in the boarding session. The themes covered how to deal with suspected child abuse cases as well. Ms. Lillian Kwok. Thank you, Chair. I have a ton of questions about this topic because I have been working with schools for many years. I have been a special school teacher for a long time. It seems that we have been burning a lot of money in promoting integrated education, but everyone is not happy. Teachers, frontline staff, and parents and students. I just spent 2 hours talking to a parent dealing with issues she encountered in integrated education. So I urge the government to pay attention to the following issues. First, funding. Now, under the three-tier support model, according to students' number, schools would receive funding support from the EDB. Now, for SEND students, we have a cap. Say, for example, if a school has taken more SEND students than expected, under the cap, only 20 SEND students would be given support. So the additional SEND students will not get any support. Now, for some mainstream school, their enrollments of special needs students have exceeded 20% to 50% even. Now, for some schools, they are not special schools, neither are they ordinary schools, but 100% of students in those schools are SEND students. So what is their positioning? Is there a special arrangement for funding support for them? Now, second question about preschool children in kindergarten. Now, preschool funding for SEND students is under the portfolio of the Social Welfare Department. So I'm surprised the SWT is not here with us. Now, for SEND students in kindergarten, they don't receive a dime. Class-based support is not given by schools because the schools won't receive a dime from the government. They only receive preschool assessment. Now, if we want to enhance class-based support, shouldn't we provide funding for kindergarten to do this? Now, third question, SENCO, or Special Educational Needs Coordinator. Now, SENCO is a good idea, but many coordinators, many teachers were assigned the role without any training beforehand. They only received training afterwards. So how many SENCOs are yet to receive training but already assigned to the role? 3 questions first. Mr. C. Thank you, Chair, and thank you, Ms. Lillian Kwok, for your 3 questions. About the learning support grant for ordinary schools. Currently, there are 3 indicators according to which we disperse the grants, and also there is a cap arrangement. After all, ordinary schools are different from special schools. Ordinary schools adopt the approach of integrated education. If, like the school mentioned by the member, that is Chilean Buddhist Secondary School, if 100% of students is special educational needs students, that would be against the concept because that should be a special school. For integrated education, only a percentage of students in the school are SEND students. So from the perspective of education and curriculum arrangement, there is a distinction between special schools and ordinary schools. To be honest, the per unit support for special school is higher than that for ordinary school. So Ms. Lillian Kwok mentioned a school with a higher percentage of SEN students. There should be special arrangement in curriculum arrangement. So as per our previous discussion with Ms. Lillian Kwok, we can provide flexibility to the school in terms of school-based curriculum design. However, the bottom line is it is not a special school, so the funding support would be different from that for ordinary schools. In terms of kindergarten, in terms of supporting kindergarteners with special educational needs, we work closely together with the Health Bureau, the Hospital Authority, and the Social Welfare Department. There is a division of labor. The Health Bureau and the Hospital Authority provide assessment and treatment services. SWD provides preschool rehabilitation services. The ADB would provide teacher training and parent support. Ms. Lillian Kwok is right. The SWD provides preschool on-site rehabilitation services. So for in-scope kindergartens and eligible students or pupils, they would be provided with preschool rehabilitation services. So we do provide support, funding support for kindergartens. Now, prior to the 2017 and 18 school year, the teacher-to-pupil ratio was 1:15. Now the ratio is enhanced. Now the committee recommended 1:12 and then revised it upward to 1:11 so as to provide better support to kindergarteners with special educational needs. Now the teachers in kindergarten are very busy. So that's why we have revised the ratio upward to 1:11 so that teaching resources can be better utilized to support the diverse needs of kindergarteners. Also, there can be more collaboration with the multidisciplinary team at schools.
Third, on SENCO, that is Special Educational Needs Coordination Officers. All new SENCO will have to undertake a 120-hour professional training program offered by the Education Bureau. We will form a learning circle and encourage exchanges among SENCOs. We organize thematic training activities in different clusters to promote experience sharing and collaboration among different schools to cater for students with SEN. The training course is offered directly by the Education Bureau, and we attach a lot of importance to the training of SENCO. Madam Chair, I'd like to follow up on my question. Some schools cannot exhaust all of the grant, but for Band 3 students, they are subject to only half of the grant. Shouldn't we allocate resources according to the number of SEN students in school, just like the non-ethnic Chinese students? And how come some SENCO can take up the role without any training? Next, Dr. Taek-ji-yoon. Thank you, Madam Chair. In promoting special education and integrated education, we have dedicated much resources. Our concepts are clear. We do have our own modes of integration and methodology. in promoting integrated education in schools. But it seems that our training is not professional enough. In the 1990s, 1993, we started promoting integrated education. I was the chairman of the steering committee on integrated education. We try to be professional. That is, we only should allow 5 SEN students in a mainstream school, and there should be a professional team in the Education Bureau to design for the curriculum. And then that team will line up the schools with Education Bureau and community resources to help this group of people or students. The outcome was great, and we were very encouraged. In times, parents became more confident in integrated education. That was a great start for us. However, as time went by, there were more and more SEN students. Now, Education Bureau is only offering grant to schools to improve the service. I think that the Bureau is no longer attaching importance to the content of the curriculum or the details. So I have a few questions. First, early identification. It would be the best if we can identify students with SEN during kindergarten or preschool period. However, identification takes time. I think that there should be zero waiting before a student can be screened so that there can be follow-up action. Second, there should be an individual education plan. Some schools may have it, but say, for example, if a school have 20 SEN students, do the school formulate individual education plan for each and all of the 20 SEN students in cultivating their motivation to learn? With the heavy workload of the teachers, I wonder if the individual education plans are actually implemented. That's how we assess the outcome of integrated education. So I wonder how effective this individual education plan is. Third, integration into the community post-graduation. I do see some progress in the work of the Education Bureau, but it's still quite disappointing in the sense that a lot of SEN students upon graduation can't get a job. There is job matching services, but we don't have job coaching or job design. Different SEN students have different skills and capabilities. I think that we need to provide coaching services. Lastly, collaboration among medical sector, schools, and the educational sector. I think that there should be a comprehensive review. We have spent much resources on our policies, but I don't see result. How can we actually help our students? I hope that the government can review integrated education holistically. Undersecretary. Thank you, Madam Chair. Thank you, Dr. Tick. I don't agree that our approach is not professional or not effective. As I mentioned in my opening remarks, we are not only offering manpower support or financial assistance. We have teacher and learning materials and teacher training. We attach a lot of importance to professional support. I did not detail the support that we have in the interest of time, but as for how we support students with autism, we do have a tiered intervention model. This is an evidence support approach. A lot of scholars and experts say that we need to adopt an evidence-based approach for our support to be effective. We need to cater to the different capabilities of students. For SEN student, we do have an individual education plan. We don't just look at their academic performance. We look at how they improve in their social skills and their communication skills, for example. We look at the performance of the students as a whole. As for students with different types of special educational needs, we engage professionals to give us advice as to how we can continue to improve the effectiveness of our policies and support. The member also asked about graduates. Well, for secondary school students in special schools and ordinary schools, how can they be promoted to the tertiary education? Some students may enter UGC-funded universities. We have special grant for UGC-funded universities so that they can offer special support to SEN students. In the 3 academic years, we have allocated $7 million to enhance support for SEN students. The member is concerned about the coverage of the fund. Well, we actually also support employment assistance. After the graduates have been employed, we try to assist the employers in offering training, but we offer support to the SEN students transition from schools to workplace. We help them deploy their skills learned in schools and their jobs. We have allocated more resources to VTC and UGC-funded universities. The member talked about social, medical, and community collaboration. The member also talked about early intervention, early identification. Well, that's exactly the area that we need: social, community, academic, and medical collaboration. Some cases need to be handled by medical practitioners and social workers. Through the multidisciplinary team that we have, we offer support to SEN students. Thank you, Madam Chair. Next, Ms. Doreen Kong. Thank you, Madam Chair. As far as I understand, we have more and more SEN students, so I support the administration dedicating resources to help students with special educational needs. I have 3 questions. First, in the paper, it is said that the administration offer regular grant. I see that they have expanded the one-off grant that they offer. Also, they also have a new technology fund for schools, and they also have the enhanced school-based support. I wonder how much the government spent on regular grant for schools. I asked this question because I want to see how the administration assess the effectiveness of these grants. That's my first question. Second, on manpower. Now, in terms of manpower resources, well, in some schools, the teachers to student ratio is lower because some students need more support. I wonder if we have sufficient manpower to cater to the different needs of the students. Now, do we have support or sufficient support for our teachers in terms of training so that they can cater to different learning needs of different students? For special education, what is the quality of our teachers? How can we attract talents to dedicate themselves in the special education field? What is the wastage rate? How do you attract quality talents?
係關於嗰個
The last question is about SAMIS, the Special Educational Needs Information System. Gargantuan amounts of data would be collected on this platform for analytical purposes. So how will you analyze the data collected through the SAMIS to identify the needs and challenges faced by SEN students? Under Secretary. Thank you, Chair, and thank you, Ms. Kong. 3 questions concerning our investment in special education. In the 2024 to 5 school year, we have allocated some $3.9 billion in special education, compared with 20 to 21 financial year, $2.1 billion. There is an increase of 22%. On integrated education for the 2024-25 school year, the estimate is $4.1 billion. Compared with 2021, $3.3 billion, there is also an increase of 24%. This reflects our focus on providing support to SEN students. As Ms. Kong mentioned, the number of students requiring support has increased in recent years. It is also reflected in the increase in service provision. We have been discussing with schools on how we can better support schools. Sometimes it's not just about funding. Even with a vacancy, some schools are unable to fill the vacancy. In the past, we were less flexible. Now, schools are allowed to use the funding to hire services. So on whether we are spending our resources effectively, we seek to achieve that by communicating with schools, the frontline teachers in schools. School principals and teachers are dealing with SEN students every day, so they can tell us what aspects need to be enhanced. And also, application of technology is more widespread in schools. Technologies facilitates learning by students in class. The overall learning quality has increased because of that. So we are dedicating more resources to schools to apply technologies to help students attain the learning level in accordance with their abilities. In terms of retaining talent, and prior to joining a school, introductory training will be provided to teachers. And also we have the BAD course, that is basic, advanced, and thematic courses for teachers. So we have set a target for both ordinary and special schools to have a percentage of the teachers completing the BAD courses. So let me share some of my personal experience. When I was a secondary student, I volunteered at special schools as well. So we have discussed the idea with special school principals. Under the spirit of integrated education, we would like to help students build empathy and a will to serve in the special education sector. This may replenish the talent pool. Attrition and wastage is a constant. Now, the SENCO is a promotional grade. The teachers working in special school are already experienced in taking care of SEN students. So because of the promotion to SENCO, the attrition rate in special schools has increased, but the situation has stabilized recently. Now about the SAMIS. SAMIS is an information system for sharing of information in schools, from kindergarten to primary and secondary schools and post-secondary institutions. When a student is transferred to another school, in the transitional period, some information should be passed on to the next school. So under SAMIS, information would be passed on to the subsequent schools. For example, when a primary school student is going to graduate to secondary school, the secondary school would receive information about the SEN students from SAMIS. Now, we are not using the data to conduct an in-depth analysis of the situation of individual students, but we do seek to enhance our support via other approaches. For example, the empirical-based, the evidence-based approach in reviewing how we can enhance the performance. Mr. Dennis Leung. Thank you, Chair. Concerning supporting services provided for students with disabilities or special educational needs, the Education Bureau has been dedicating more resources to care for the varied needs. But I have several questions. Special schools in Hong Kong were established very early on. Many of their campuses are small. The design have not taken into account of the surge in number of SEN students. Some schools really need a new school premises to improve the learning environment for special school students. And more special needs students required boarding services. So in terms of school premises swap or in situ redevelopment, what is the Education Bureau's plan? Second question, under the integrated education system, there are special educational needs students in ordinary schools, and teachers would receive training. Now, this paper didn't give us any figure on this. Do you have a number on the do you have the number of teachers in mainstream schools who have received SEN training? How experienced are these teachers, and what is the number of such teachers in each school on average? And also the ratio of SEN trained teachers compared with the number of SEN students in the school? Is the teacher-student ratio high enough? If training is insufficient, should we allocate more resources to train up more SEN teachers to provide adequate support and education for SEN students? Third question. Now, let's say for Chen Nam Chong School, there are school social workers following up on graduates up to 2 years after graduation. So how are these graduates doing in society? For example, job and living. Are they self-sufficient? If not, more support should be given to them by society. But this is a program run by the Social Welfare Department, which is absent in this meeting. So before graduation, how much support is given to these soon-to-be graduates to chart the course forward? I think society as a whole need to support special school leavers to become self-sufficient. Now, fourth question. Ordinary students in mainstream schools are not very familiar with the needs of SEN students. Will these ordinary students be taught to identify the needs of special needs students so that more support can be given to SEN students? That's how we can achieve the true spirit of integrated education. Teachers alone are not enough. We need the help of students as well. Mr. Jeff C. Thank you, Chair, and thank you, Mr. Leung. 4 questions. First, concerning old school premises of ordinary or special schools. We are seeking suitable locations for redevelopment or reprovisioning of these schools. Now, for some schools with boarding sessions, for example, special schools for students with moderate intellectual disabilities, we will help them to improve their boarding sessions to improve the living environment. In terms of SEN training for teachers, we have an indicator for both ordinary and special schools. For ordinary schools, the indicator is set at 80% for basic course and 20% for advanced course and 25% for thematic courses in public sector ordinary schools by the end of year 2026 to 27. Now, there is still some time before the 2026 to 27 academic year. So we are looking at how schools are achieving the indicators. For those still falling behind, we are reminding the schools to enroll their teachers in the new round of courses. There are similar indicators for special schools, for same indicators for hospital schools and group schools. For special schools for students with hearing or visual impairments, we require 85% of teachers or above to have undergone more than 240 hours of SEN training. Third question about Chen Nam Chong schools. There are 2. One is a group school. The other one is a school for students with moderate intellectual disabilities. Now, the situation is, within 2 years after graduation, school social workers would follow up the cases with the parents, carers, and the students themselves on how well they are adapting. And while queuing for post-graduation services, students will be referred to supporting centers for persons with disabilities or integrated support centers for families to receive interim services. Any needs in the interim would be addressed by these referrals. Now, about the true spirit of integrated education, I fully agree with Mr. Leung. The concept of integrated education is to provide education to both ordinary students and SEND students to interact in harmony. Now, there must be some differences in terms of their learning progress. That's only natural. Now, with a more diverse pedagogical approach, there are more group activities in class. And there are more outside the classroom activities like sports activities, exchanges, and visits to nurture friendship between different students. So that's why we are implementing integrated education. We emphasized on the whole school approach to create a truly harmonized environment. Not just schools, the society as well.
陳海欣議員。
Ms. Chen Haiyan. Thank you, Madam Chair. Sorry, I was in another meeting just now. I am concerned about STEM students. I came across a case where a child is dyslexic, and that child was asked to undergo a screening by a third party by the school. And I was told that the report can only be out in 3 months' time because the child does not only have to undergo screening, they also have to meet psychologists or other experts before a report can be written on how serious the dyslexia is. That child sometimes mixed up different pictures and have problems with mathematics. But that child has to go to an accreditation organization to undergo such a screening. And the fees charged by this kind of organization is not cheap. Sometimes teachers or parents don't know where to look for this kind of organizations. I wonder what support the Education Bureau has for this group of students. I understand the concept of integrated education. We want the SEND students to enjoy school life with other ordinary students. But after the psychological assessment, students with dyslexia or attention deficiency problems, they are given extended examination hours and they had to take the examination in other classrooms. After the examination, the students felt ashamed that they had to take the examination in other classrooms, and they were asked by their fellows schoolmates why they're not taking the exam together. Some students enjoy special treatment because they have attention deficiency. They may be troubled by other students flipping their papers. I have received quite a number of such complaints and worries from parents. The schools may have good intention in such an arrangement, but we have to pay attention to how these SEN students are being affected. I wonder how we can help this group of students. Undersecretary, thank you, Ms. Chan. Regarding the two cases that you quoted, this shows that there is not a set of golden rule on how we can treat all SEN students. We try to offer more training to teachers. As I mentioned, we have this SENCO position. We form learning circles for students, for teachers or SENCOs in different clusters for experience sharing. In this learning circle, SENCOs and teachers can share their experience on how they can offer appropriate support to students. As for the issue on assessment, we have to rely on experts. Sometimes it takes long-term observation before a decision can be made as to whether the students have special educational needs. I believe that the SENCOs are equipped with such knowledge, but for complicated cases, they may reach out to our special education division. Our professional colleagues may be able to offer some advice to individual schools or parents. As for the second case on extended examination hours for SEN students, we do have special arrangement under the DSE for SEN students as well. SEN students with special arrangement have to take their examination in another classroom. We're not trying to label those students, but I'm sure that you understand that, say, for example, most students complete the examination in 2 hours, but some other students enjoy 2 hour 15 minutes of examination period, then some students may find it unfair and weird. That's why we need to designate an extra classroom for this group of people. Extended examination hour is just one kind of special arrangement. Some students need color adjustment. Some students need enlarged font on their examination papers. All these are special arrangement for examinations for STEM students. Schools and parents should explain to students why this is the case. We're not trying to label the students, but everyone is different. The arrangement is professionally designed. Madam Chair, I have a suggestion. Well, parents these days have more awareness on special education needs students, and a lot of them go for assessment at external organizations. I wonder if the Education Bureau will provide assessment services. A lot of organizations on the private market claim that they are able to provide DNA examination on their children to see if they have special educational needs. This is my suggestion. Three minutes, second round. Dr. Teck Chi-yun, Deputy Chairman. Thank you, Madam Chair. We have discussed this item for almost 2 hours. We know what the members are concerned about. The Undersecretary is trying hard to explain. But it seems that we don't know what the next step is. In the administration's paper, it is said that the Education Bureau will enhance resources and improve their measures. These are rather vague. If the issues that we raised cannot be properly addressed, then all efforts will be futile. I think that we should focus on individual education plan. How do we identify SEN early? How do we introduce professional intervention? These issues have not been addressed. I hope that the Education Bureau will look into the operation of individual education plan at schools. Maybe you can send your experts to schools to look at the implementation. Academic results is not the best way to assess our students, but individual education plan. That's how we become more professional in helping our students. Undersecretary. Thank you, Madam Chair. Thank you, Dr. Tick. I don't agree that individual education plan can solve the issue with early identification. We have to first identify the special education needs that the students have. And if they are studying in ordinary school, at Tier 3, we offer individual education plan tailored for that particular student so that we can follow up on their learning progress and their growth. We have discussed this issue of IEP multiple times, and the Education Bureau is well aware of its implementation at different schools. It's easy to tick the boxes on the IEP and submit it to the Education Bureau for schools. But does filling out the form mean that the students are well taken care of? Should we ask our teachers to spend so much time on paperwork? There were suggestions on asking the teachers to fill out IEP form not only for Tier 3 students but also Tier 1 and Tier 2 students. However, that implied an increase of workload amongst teachers. That may not be the best way for us to solve the issue. For IEP, we do have such an arrangement for Tier 3 students. For Tier 1 and Tier 2 students, we have other ways to help them. We will continue to talk to the educational sector to see how we can improve our measures. We did discuss this issue previously. We hear the members' views and we get it. I'm not trying to debate with you. I hope that we can be pragmatic. The administration said that their measures are comprehensive, but if that's the case, then we wouldn't have so many incidents. There's no point in arguing. You're a professional. As long as we can help our students, that's all right. But a lot of parents are faced with difficulties, and that's the reality.
Ms. Lillian Kwok. Thank you, Chair. Now, first of all, I state my support for the idea of IEP. I have formulated a lot of IEP, individualized education plans, in even mainstream schools. Now, under the three-tier support system, on the third tier, multiple disciplinary professionals, including counselors, social workers, teachers, speech therapists, and psychologists will work together to work out a work plan to support the parents and the students. Counseling services will also be included. So IEP is actually a very difficult task. It takes a lot of efforts to formulate just one IEP for a student. So to make it effective, it must be a lot of experts must be involved. So many schools are reluctant at the idea of formulation of IEP for students. Now, according to the parents I talked to yesterday, it seems to my ears that the student in question requires an IEP, but the school is not prepared to do that. So that is a school-based decision to be made. So it gives the perception that there are inadequate support for school in formulation of IEP. Now, we need to help SEN students to adapt to the community and society as well, not just in schools. Now, in Finland, there are shadow teachers. One additional teacher would be assigned to a classroom for supporting SEN students. However, over the past 20 years, administrative work in schools have become more heavy. So the learning support grant was used to hire teachers to provide out-of-class services, for example, clerical work or after-school support, but not in classrooms. Like Dr. Tik Ji-yin said, some teachers are just hired to fill out forms. We need to conduct a review on how we can enhance the system to make sure that the resources are well spent. Now, parents are under immense pressure. However, it seems support is only given to schools and SEN students in the community. What about at home? Now, another thing just came to my mind. Now, we adopt a diverse approach in assessment. Now, very earlier on, I have been using some storybooks to help assess the ability of the students. If you are just using a standardized form, you will never be able to conduct an effective assessment. So like Dr. Tik Ji-yin said, it's 20 years now. We need to conduct a comprehensive review of our integrated education system. Please be brief, Mr. Jeffsey. Thank you, Chair, and thank you, Ms. Kwok. You have shared with us a lot of real difficulties faced by frontline staff, particularly on parent education. We want to help parents to acquire parenting skills to support SEN students. So we have prepared information pamphlets and also available resources on the Smart Parents Net. Some modules are very useful. We will continue to develop resources to help stakeholders respect individual differences more. Now, just one remark, we need to pay attention to parents' psychological health. Without a healthy emotion, the atmosphere in family would be very negative. So we need to provide more support in terms of mental health for parents. Now, this is my turn. Many members have spoken on the situation of support services for SEN students and students with disabilities. Now, I agree with them. The effort is not quite there. Now, we have a $3.9 billion dedicated to the cause, but effective help does not reach SEN families. What about the zero waiting time? There is still a long waiting list for special school quota places. Special school leavers cannot find a suitable job after leaving schools and there is no tailor-made educational plan, and there is no IEP to help SEN students find a job which suits their strengths. The government is not coordinating these efforts. Individual organizations have been providing services on their own. So we need to have a overall work plan from the Education Bureau. Now, I have heard some complaints from groups for the hearing impaired. Now, hearing aid is an issue. Now, support or subsidy is given to parents of children with hearing impairment to buy hearing assistive devices. However, some parents found that the eligible devices are of a poor quality. That's why many parents choose not to use the subsidy and spend $20,000 from their own pockets to buy quality hearing assistive devices. So we need to review this program so as to provide help to students with hearing aid. It is very crucial for their healthy development. Thank you. Concerning hearing aid, I will defer the question to my colleague. First of all, on how we can better support students with disabilities or special educational needs. It is true that there's always room for improvement. Now, having listened to members' views, we will study these recommendations. I'm not saying that everything is perfect as is. Now, you might remember when we implement the 3-3-4 arrangement in schools, many SEN parents told us that it is not likely that their children will receive post-secondary education. But we have heard different views. Of course, we shouldn't gauge the success of our programs by how much we are spending on the course, but indeed we have increased the amount of resources allocated to this course by much. For example, there is more funding support for SEN students in post-secondary institutions. So after revamping the post-secondary education school years, we have been providing more support for SEN students. Now, concerning hearing assistive device, may I invite my colleague to speak? Thank you. We do provide hearing assistive device to students in need. Every 3 years, if there is a need to change, they can obtain a new hearing assistive device. And concerning how students can use hearing aid in campus, we have experts helping students to do that. Thank you. Now, we are overrunning for this item, so I'm not going to allow a third round. My apologies. So thank you for the Education Bureau for attending this item. Item 2, medical needs of and services for persons with disabilities. We will now invite the representatives from the Health Bureau to come in.
就住殘疾人士醫療
On medical needs of PWDs, please refer to paper CB brackets 1167303. In attendance for this item are Mr. Eddie Lee Lik Kwong, Deputy Secretary for Health, and Mrs. Suzanne Ip, Principal Executive Manager of the Health Bureau, Dr. Rico Chu, Senior Dental Officer, and Dr. Larry Lee, Chief Manager of DHA. Mr. Ed Lee, please. Thank you, Chair. Good morning, members. The government has all along been providing various medical services to PWDs. Through various departments, we have been providing medical treatment, infirmary, and rehabilitation services and allowances to PWDs. These departments include the Department of Health, Hospital Authority, and the SWT, as well as a close collaboration between the departments. We deliver a wide range of support services to PWDs and review these services from time to time. Now, the examples of specific measures are included in the paper. For example, as the maternal and child health centers, students' health vaccination, oral health. Now, in terms of oral health care, last week, the Working Group on Oral Health and Dental Care published the action agenda on oral health, dedicating special support for people with disabilities and special needs. We also have outreach services provided by the HA and RCHD and psychiatric services. There are also dedicated support grants and allowances to support PWDs in receiving medical treatment, as well as alleviating stress on carers. Now, in the interest of time, I'm not going to repeat the programs mentioned on the paper. I will stop here and take members' questions. Members who would like to speak, please press the button. For the first round, each member will have 4 minutes, questions and answers included. Professor Chen Wing-Kwong. Thank you, Chair. Having read the 4-page documents provided by the government, I think there is only very limited medical support services for PWDs provided by the government. The crux issue is the shortage of healthcare manpower. Now, with the introduction of non-locally trained healthcare professionals, I hope that more support services can be provided for PWDs. Now, my questions are as follows. At present, most of the government-subsidized Chinese medicine clinic do not receive a full waiver for full subsidies for PWDs. Now, the per consultation subsidy is $120 for those in the CSSA, but PWDs are not benefited. There's also not a subsidy for PWDs in receiving Chinese Western medicine joint consultation session. Now, a lot of PWDs do not get support for receiving Chinese medicine services. So will the fee waiver scheme be extended to PWD as well, so that PWDs can make use of Chinese medicine services? Second, PWDs need all sorts of rehabilitation tools or devices, and many of these devices are expensive and unaffordable. According to paragraph 15, the SWD only disperse special care subsidy for the severely disabled who are recipients of CSSAs. As a result, many disabled persons would be very careful in spending the subsidy. And also, some PWDs will be reluctant to give up their job to apply for CSSA in order to qualify for this special care subsidy. So the government consider creating a special subsidy dedicated to buying medical devices to enhance the living conditions of PWDs.
Deputy Secretary. Thank you, Professor Chen, for the question. I think that he was asking about the support that we offer to non-CSSA PWDs. Well, this issue is actually under the purview of LWB, but we are in close liaison with them. I understand that the LWB is offering subsidy to them. Under the Community Care Fund in 2011, there was a special care subsidy for the severely disabled. In October 2023, we have regularized the special care subsidy, and the subsidy has been raised from $2,000 to $2,500. On top of this subsidy, we also have integrated support service for persons with severe physical disabilities. By this kind of subsidy, we're talking about renting respiratory support medical equipment and special subsidy for purchasing medical consumables. Apart from subsidy, under the hospital authority, we also have a mechanism on full or partial exemption of medical fees. Medical social workers conduct such assessment. For non-CSSA recipients with disabilities, we treat them the same as CSSA recipients. If they have any medical needs, they will be supported by our medical social workers. If they require expensive treatment and medicine, we also have a mechanism to deal with that. As mentioned by Mr. Lee, for expensive medicine, we do provide a safety net through our community care fund, other support. We try to help this group of people. We try to provide outpatient services and outreach support to people with disability, and we try to lower the cost for them. Madam Chair, I'm concerned about the service offered by Chinese medicine clinics because PWDs need Chinese medicine services as well, but CM clinics cannot offer discounts for PWDs. Deputy Secretary, I think that you're talking about CMCTR, outpatient service charges. Well, I understand your concern. We tie that with the medical charges exemption under the hospital authority. TPWD enjoy exemption from medical fees under CM clinics as well, but we note your concern. Next, Dr. Teck Chi-yun, Deputy Chairman. Thank you, Madam Chair. 2 questions. First, for patients with rare diseases, most of them are people with disabilities. They said that a lot of the medicine that they take are outside the scope of the drug formulary. I visited some private hospitals in Shenzhen, and I asked them the cost of medicine there, and I found that it was much cheaper. That's because private hospitals purchase these medicine in bulk. That's why the cost is lower. As we are integrating into the Greater Bay Area, is it possible for patients with rare disease to purchase medicine on the mainland? It would be the best if you can include these expensive drugs in your drug formulary. Will you consider the mechanism that I just proposed? Second, I also came across cases where PWDs create pressure for their family members and caregivers. From the perspective of doctors and medical practitioners, they look at the illness, but for people who are psychologically troubled, they sometimes visit the hospital. Is it possible for the medical practitioners in hospitals to identify people with psychological problems? Can we refer them to psychological clinics by leveraging our social work officers? Is there a mechanism for us to identify psychological problems among people with disabilities? Do we have a mechanism to refer them to community services? Deputy Secretary. Thank you, Dr. Tick, for the question. 2 questions. First, on the the medicine cost of people with rare disease, and 2, the psychological problems of PWDs. Now, I will ask Dr. Lee to supplement, but I can share with you some principles of drug procurement. Our hospital system provide medical services to local patients. A lot of people have suggested the hospital authority procuring medicine together with private hospitals on the mainland. But under the one country, two systems principle, we have 2 sets of medicine regulation on the mainland and Hong Kong. We don't share the same medicine monitoring and regulation mechanism, and we do have different pricing strategies. Patients procuring the same medicine on the mainland may pose long-term implications to our system, but as we procure the medication, we'll make reference to the price for the same medication on the mainland, and that's what we look into when we procure our medication. On the expensive drugs of patients with rare diseases, we do have a mechanism. I will ask Dr. Lee to elaborate. Dr. Lee, thank you. Just now, the Deputy Secretary said that under the one country, two systems, we don't have a seamless integration in terms of medicine monitoring and regulation. The 1+ mechanism has sped up our drug approval process, and we are concurrently reviewing our procedures. We try to speed up all sorts of procedures so that we can include more drugs in our drug formulary. However, we do receive feedback saying that some useful drugs have not been included in the drug formulary. We ask for your understanding. We need scientific evidence and data to support our inclusion of certain drugs into the formulary. If our patients want to purchase drugs on the mainland, we'll try to support them. For patients with rare diseases, they have different needs. We have a working group to look into their demand. Apart from drugs, they have different dietary requirements. We try to care for them in this area. As for support for family members, we do have a mechanism under the HA goal to refer relevant cases. I have a follow-up question. Say, for example, if there was a patient who comes to see the doctor at your hospital, will you be asking that patient about the background of that patient to see if their caregivers or family members are under great stress, so that we can identify high-risk cases early. Thank you. If I were a clinical officer or a doctor or nurse, if I come across such case, and I will refer the case to the social work officers. We may refer them to clinical psychologists or the psychiatry department. Next, Ms. Chen Hao-Yan. Thank you, Madam Chair. I have two questions. First, on dental care and oral health. On school dental services, the Department of Health has been helping students with intellectual disability and physical disability. But as students reached 18 years old, the Department of Health instead adopt this collaboration, health teeth collaboration scheme. People with intellectual disability ID sometimes refuse their parents for brushing their teeth. And most of them become very anxious when they see the dentist. That's why we really need this healthy teeth collaboration scheme. Please don't spend any time explaining about it. I know very well about the scheme, but for persons with ID aged 18 or above, nowadays their life expectancy is longer. The parents are worried about cancellation of services because some of the NGOs leave the system previously. I think that perhaps the Department of Health can provide dedicated services to persons with ID aged 18 or above instead of relying on just the NGOs. Parents told me that persons with ID now live longer and they become very emotional when they suffer from dental illnesses. So I hope that we can provide further services to them to improve the situation. For reservation of rehab buses, the quotas is often not enough. For wheelchair users, they suffer from different diseases. I know that you have outreach services, but with the increase in demand, is there any room for us to increase the outreach services that we offer for PWDs? If the PWDs cannot book the rehab bus, then they would not have their wounds cleansed or rinsed. Do we have any support for this group of people? Deputy Secretary, I will ask Dr. Chu to talk about the healthy teeth collaboration for rehab bus. I will ask Dr. Lee to elaborate. Ms. Chan has pinpointed the crux of the issue. Currently, our public services cover all sorts of needs of persons with ID throughout their lives. The Working Group on Oral Health and Dental Care has reviewed the schemes that we have. A lot of NGOs are passionate about the services that they provide, but some dentists lack training in special services. For the maxillofacial departments, we try to enhance training on special care for persons with IDs. Sometimes we may have to sedate the persons with IDs in order for us to fix their teeth. So we have to enhance a special care training for a dentist. Now, we also ask our teaching schools to enhance special care dentistry training. We will look into categorizing special care dentistry as a specialty or subspecialty. As for healthy teeth collaboration, I will ask Dr. Chi to briefly talk about that, and then Dr. Lee will talk about rehab bus.
Dr. Chu, thank you, Ms. Chan, for your question. The Healthy Teeth Collaboration program is extended to March 2027 and has been extended to cover persons with an autism spectrum disorder. Now it is a 3-year service period. Renewal of resources is needed, so we are extending the program by another 3 years. We know there is restriction on the program, and it is difficult to move the patients to the dental chair. So in the future, we are going to work with the Departments of Health to see whether we can extend these services to outside of dental clinics. And also the scope of service, besides persons with intellectual disabilities and persons with ASD, we will consider whether we can extend the scope of service to persons with other disabilities. We are studying the feasibility of that, and we are going to collect views from stakeholders and consider the way forward. Mr. Eddie Lee, or Dr. Lee, on rehab bus or transportation services for patients to receive consultation. It is about the cost. It is unfeasible to expand the resources dedicated to transportation services unlimitedly. So many of our services are shifting their focus to day or outreach services. Now we have a seriously aging population. Now for outreach services, we can at best do some wound cleansing or home assessment. We need to develop telemedicine more rapidly. Now, many stable patients do not actually have to receive consultation in hospital. Rather, telemedicine plus outreach services will suffice. Next, Mr. Andrew Lam. Thank you, Chair. My question is about demand for rehabilitation services. For rehabilitation, bed spaces in day hospital, I know there is pressure. Have you conducted a study on the future shortfall of services? From the previous answer, I learned that you do have some directions, but will they be implemented in time to deal with the rapid surge in service demand? I know you are conducting a study, but I didn't hear a timetable. You have a direction, you know what to do, but how serious is the problem? How big a step you need to take to overcome the gap? Thank you. Mr. Adderley, I will defer the question to Dr. Larry Lee. Thank you, Mr. Chan, for your questions. In terms of direction, we witnessed a rapid surge in demand for services in various medical disciplines. With an aging population, we can't just keep adding beds to our hospitals. So besides hospital services, we are going to explore the development of other services like day services. Under the HA, there are two types of day services. One is the day hospital, covering geriatric and rehabilitation disciplines. And also there is day rehabilitation services, for example, endoscope services or minor surgeries. So these are the key directions we are going to pursue. Also, outreach services. Previously, outreach services were mainly provided by nurses and occupational professionals. Now we have included geriatric assessment services as well, especially when the weather gets cold. We need more such outreach services to help elderly at home. This will reduce the pressure on our CHDs and our hospitals. Now, from what I heard, it seems that it is not quite feasible to keep adding beds to hospitals. The paper says there are 5,000 beds in the hospital. So I take that you don't have a plan to increase numbers of beds in hospital, but rather you would address the surge in demand by providing more day services. Now, for elderly people, the quota is 1,000 per day. So will you increase the number of quota since you can't add beds? What about quota, and what's the timetable? Dr. Lee, under the HA, there are some 3,000 beds. For rehabilitation beds, there are some 5,000. We have been adding beds. For example, in year 2023 to 4, we have added 150 hospital beds. But as I said, the pace of increase in beds cannot catch up with the surge in healthcare demand. So we will shift our focus to day services. About the 1,000 quota of day places for the geriatric discipline, we have also increased the level of services. What I mentioned was outreach home assessment or home geriatric services. This is a more ideal approach. We have been dialing up provision of this service in the past. We have been monitoring the service level at our CHDs to see whether we can enhance the coverage. Now, this is my turn. I have several questions. Some members ask about the expenditure on medical expenditure on PWDs. Over the past years, I've received complaints from the wheelchair-bound. Now, some PWDs do receive medical allowances because of high age or disabilities, but there is a group of wheelchair-bound people who are not supported by the CCF, but they do receive higher disability allowance. but they cannot afford maintenance cost of their wheelchair. Now they are, despite living with their family members, despite getting support from their family members, in the long run, they cannot afford the maintenance fee of the wheelchair. So for a group of people who are so far supported by their family members, especially the wheelchair-bound, can we provide support for them to purchase medical devices under the CCF? We have been calling for the introduction of a voucher for rehabilitation devices. Second, about comorbid diseases of the PWDs. Now, for those who have complicated medical needs, for example, patients who need a transferal from the pediatric division to the adult department, in August, the government said that there is a study about assigning doctors or consultant doctors or nurses as coordinators. The Duchess of Kent Children's Hospital will implement this pilot program first. Now, when necessary, these coordinators can act as a go-between for the parents and the relevant doctors. Now, several months have passed. How is this program received? How many people will benefit from this program? And will you consider regularizing the program? Mr. Adili, thank you. I will take the first question. Second, about the pilot scheme, I will defer to Dr. Larry Lee. Professor Chen and the chairperson also mentioned allowances or subsidies for the severely disabled not under the CSSA. Now, this is under the portfolio of the Labor and Welfare Bureau, but we have had a discussion with them. Now, there are several grants at present, for example, the disability allowance and the higher disability allowance. Besides, there is also the regularized special care subsidy for the severely disabled. There is also the comprehensive or integrated support services for the severely disabled. They covered cash allowances as well as allowances for medical consumables. Of course, for non-CSSA recipients, they may be left out. For example, maintenance costs or repair costs for wheelchairs. Now, there are some complementary programs run by NGOs. For example, under the community chest, there is a program for supporting purchase or repair of wheelchairs. So I will take the comments to the Labor and Welfare Bureau. What I want to say is that there is already a number of programs ongoing. Mr. Adili, I agree that there are some support for the PWDs, but they are all means tested. However, many PWDs are being cared for by their family members. It is a huge ask for the carers to provide long-term care. Many carers have to give up their jobs to care for their child full-time. So not every family can do that. So please consider my recommendations.
Dr. Lee, thank you, Madam Chair. Regarding the pilot scheme relating to the Duchess of Kent Children's Hospital, I don't have the relevant information at hand, but let me talk about how we deal with children who are being transitioned from pediatric department to adult department. For Duchess of Kent Children's Hospital, their patients, we engage our consultant nurses to help children cope with transition. For children with severe intellectual disability, they are under the purview of the Caritas Hospital. When they become adults, they will be transferred to Siloam Hospital. There is a coordination mechanism between the two hospitals. Let me quote a special example. For children with rare illnesses, after that child reaches 18 years old, we assign a case manager for that patient. We offer remote consultation. Only after the handover or the remote hearing process is completed will the child be transitioned to, for example, the Queen Mary Hospital. We don't want any problems with the transfer because usually the child patient would have developed a close relationship with the pediatric doctor. Next, Ms. Doreen Kong. Thank you, Madam Chair. Sorry, I was in another meeting next door. Now, I would like to ask about the rehabilitation products of PWDs. I know that some members have spoken on this item, but I'd like to take this opportunity to say that some PWDs told me that a lot of rehabilitation products are expensive. The subsidy provided by the government is often not sufficient. And for the special care subsidy for the severely disabled, the application threshold is very high, and the subsidy does not cover all sorts of rehabilitation products. I hope that you can increase the level of subsidy so that PWDs can enjoy financial assistance on the procurement of rehabilitation products. That's my suggestion. Second, on waiting time for psychiatric department and the insufficient manpower of psychiatric nurse and case managers. There is increasing demand for psychiatric services among PWDs and even regular members of the public. Will the administration dedicate more resources to effectively detect, identify, and treat people with mental illnesses? Is there ways for us to identify hidden mental patients so that we can intervene early and treat them? Lastly, on mental health, I wonder if the administration will create a dedicated organization on it. I know that in Hong Kong, we have Psychological Health Council. Is it possible for us to upgrade the Institute of Psychological Health as a statutory organization, just like what the Singapore has done, so that we can plan our mental health policy? Deputy Secretary, let me first talk about mental health. We've talked about this in different panels in the Legislative Council. The most important thing is prevention and identification. At designated community health centers, we provide psychological health assessment. We also have evidence-based tools for such assessment. When patients with emotional support needs are identified, we refer them to in NGOs that we work with so that we can provide low-intensity counseling and support. We also have 18111 Emotional Support Hotline. We also have schemes in different districts in Hong Kong. We offer subsidy for the 18 community care teams. 1 to 2 team members will be subsidized by us to undergo emergency mental support training courses. They may not be able to deal with any mental issues immediately, but they will be equipped with relevant knowledge. So that's how we're trying to tackle the problem at the community level. Through the Mental Health Steering Committee, we are providing a tier model. Because we have different types of mental illnesses, we cannot completely just rely on the psychiatric doctors and nurses. Through the Mental Health Advisory Council, they will leverage on teachers, social workers, and counselors who have been trained to deal with basic and simple cases first. So we are working on different areas. The member asked if we have a dedicated department to work on the mental health issue. Well, we do have this Mental Health Advisory Council. The Health Bureau is the secretariat of the council, but that comprises different departments including LWB, Education Bureau, Social Welfare Department, Department of Health, NGOs. So the mechanism is already there. Outside the advisory council, we also work with different departments. So I will be able to answer questions that are not under my purview, such as those on social welfare. Thank you for the answer. I hope that the government can keep an open mind. Maybe we should upgrade the status of the Mental Health Advisory Council so that we can control the mental health issues that we have in Hong Kong. On mental health support, well, on the waiting list for children and adolescent psychiatric department or adult psychiatric department, so it is as long as 39 weeks. So I hope that there will be public-private collaboration so that we can refer Tier 3 and 4 patients to private practitioners. Will you be implementing a co-payment system so that patients can seek help from private practitioners by paying just a few $100s? With our economy deteriorating, there could be more mental health patients in the community. And we see a number of suicide cases recently. So I think that the administration should attach more importance to the mental health issues, especially the waiting time problem. Deputy Secretary, thank you. The SAR government attaches a lot of importance to this issue of mental health. That's why we've discussed this topic multiple times in different panels. We have many measures for the outpatient clinics. For Tier 1 and Tier 2 patients, we offer service to them within 1 to 4 weeks. For non-emergency cases, the waiting time is quite long. There is a public-private partnership arrangement. Sometimes the issue is not with the charges. But promotion and publicity. Because for psychiatric patients, if they're referred to private practitioners, they have to tell their story afresh. There are uncertainties. They don't want to tell their story again to another person, and they're worried about the service quality in the private market. So we're working with the hospital authority on publicity and promotion so that patients become aware of the benefits to this scheme. And we're now talking to private practitioners. A lot of them want to join the scheme. We have to identify patients that are suitable first before we expand the scheme. For the waiting time of outpatient clinics, we're able to achieve our KPIs for Tier 1 and Tier 2 patients. But for private and public partnership, we think that that is not the only way out. The hospital authority adopt different means to shorten the waiting time. Over the years, with the advancements of our medication and subsiding of COVID, we are enhancing our training for our staff. And we have dedicated more resources on community psychiatric nurses. And we want to maintain the patient-to-case manager ratio of case manager to patients. And we'd also have a very mature mental health hotline that operates 24 hours a day. Psychiatric patients can receive support. And schizophrenic cases can be dealt with by the hotline on a fast-track basis. Deputy Secretary. Some psychiatric patients have special educational needs. Can they not go for HA doctors, but go for private practitioners so that they can get rid of the medication after the conditions have stabilized? Apart from medication, intervention by educational psychologists is also crucial. That's my suggestion. That concludes this item. The next meeting will be held on the 18th of February 2025, 10:45 a.m. We're going to discuss creation of a barrier-free living environment for PWDs and the measures and services to facilitate PWDs commute. Any questions or comments? If not, the meeting is adjourned. Thank you.